I'm one of the co-founders of the Mind team, and I have worked with my other two co-founders, Jeff Spite and Nicole Bradbury, for a number of years now. We worked together previously doing behavioral health, and then moved on and decided, well, we would like to do it our own way, and we have some innovative ideas about how to do that, how to present the care to the people who need the care, and that's why I came to Mind 24/7. We do a couple of different things. One is we have what we call a no wrong door policy, and that means anyone can come in 24/7, 365 with or without insurance, and we take care of them. So one of the things that I think that we do for those patients is by doing that, improving their clinical outcomes. The first person they see isn't the person behind the desk asking for their insurance information, and it isn't someone who's going to drag you off to sit with a whole bunch of other people. The first person they see is a doctor, a nurse practitioner, or a physician assistant. They go right to the head of the line the minute they walk through the door. And it's a very different model. We have a second piece to this, which we call Progressions. And Progressions is a 30 to 90-day course of therapy, I would call it basically. And then we have our observation area where a patient can come and stay for 24 hours or longer if they need it. This is typically for a patient who is more in crisis than some others who might need that extra level of help. What we do not have is inpatient beds, because we don't want to become part of a lot of what exists, which is to just funnel people into inpatient beds. We'd like to keep them out of the ER, keep them out of the hospital by providing that level of support they need, even if it's a pretty high level of support. The emergency room is a place where you're going to go when you're in crisis and get stuck. So what happens with us is, because we have that open door policy, people can come to us first. They might get sent to us from an emergency room. They might get sent to us from their primary care provider. They might get brought to us in some certain circumstances by law enforcement. So those are the different ways patients come to us, and that keeps them out of the emergency room. I think Mind helps destigmatize the need for mental health by being there. I think the more people that come to Mind, the more people know that they can be taken care of without stigmatization. The more we present ourselves, I think, to the world, explain what it is that we do and what we are very open about and speak openly about, all of that, I think, helps destigmatize mental health.